Medical Alerts. I am Dr. Prakhar Jain, and today we have Dr. S. Prakash. He's an MS FRCS, and he is a visionary, and he's been in the medical insurance industry for the past 15 years. He's also the former Star Health Managing Director. Over to you, Dr. Sir.
आप सबको नमस्कार. I'm glad to meet you and have an interview with Insurance Alerts. Can I have your question?
Yes, sir. So, sir, today we are going to question about the future of healthcare in India, sir, or the hospitals. What is your view about it?
Yeah, the future of healthcare in India is it's like it is very contextual that we talk about it now, because it is not going to be the same as it was in the near past. So there are a lot of transformation that we foresee. Healthcare is undergoing a great metamorphosis, and in the physical, in the infrastructure, in the expertise, in the digital and technology, and also in the clinical governance, there are going to be a lot of transformation. And these transformations are not just voluntary. There may be a pressure on the hospitals because there is going to be more regulation, more accountability, and more questioning by the customers and the media. So this is time hospitals equip themselves with a lot of technological advancements and data. The data is very important, and that's going to help them grow. It need not be like small or big or quaternary hospitals. All hospitals tend to follow ethics, and whatever may be the size, a hospital that is ethical and that is able to give a good clinical outcome, it is going to have a very good future in the near future. How? Because the individuals are going to recognize, the media is going to recognize, and most important of all, the insurance companies. And insurance revenue is expected to increase at least fivefold by 2030. So the advantages of this growing health insurance business will transform into business for hospitals. So I know it is a service industry, but today it is a business because there are a lot of investments involved. But it is not a cutthroat business. It is a business with a soul, because doctors are highly qualified people. They spend a lot of time, on their, qualifications, experiences, and following a senior doctor, knowing the trade. No, with all that, by the time they are matured enough and capable of outshining, they are in their mid-40s. So they have to be respected. There should be a premium for their experience and their expertise. And health insurance companies and hospitals should have a good understanding. So today the practicing doctor has no insight about the billing of the hospitals, and the billing person who is sending the communication to the insurance company, he has no idea about the procedure.
Correct, sir.
And at the other end, there is a insurance company which is trying to process. And naturally, some of the instances I see, there are a lot of communication gap between the hospitals and the insurance companies. So over a period of time, we should build our technology platform in such a sound way, and we should be willing to learn. A person in the TPA or health insurance company who is designing a product, who is processing the claim, should know about the ground reality of what happens at the medical field, and should equip himself with the right knowledge so that he can do justice to the policyholder. Because insurance companies design the policy, whereas hospitals deliver the services. And there cannot be a disconnect between design and delivery. At the same time, the hospital authorities, be it the front office people, the finance team, the pricing team, or the treating doctors, clinicians, every one of them should spend some time to know about the requirements of insurance and insurance nuances. This is very mandatory, because when a patient comes to a specialist, it is the duty of the specialist to give a comprehensive care, total care. And this comprehensive care cannot happen without a proper financial backup. And for this financial backup, an health insurance is required. Today, the evolution of medicine and different specialties, it is growing every day. It is an evolving field. And we have treatments, we have the quality of care and treatment at par with what is available in the developed countries, but at a very, very considerable cost. These are all the strength that we have, and we have to tap that, the very essence of our strength. So is this happening today? It is not happening because hospitals, clinicians, they are not willing to spare time and know about insurance. They think that it is a job of the front office clerks. But front office clerk will not have the adequate knowledge, because if it is a cardiac problem where an electrophysiological test is done, or if there is a surgery which is done by robotic, where robotic gives a better precision, because this is a pelvic surgery, be it surgery in the lower rectum or prostate. And if it is an oncology procedure where there is a neoadjuvant treatment followed by conservation, organ conservation surgery, followed by post-operative treatment based on the definite histopathology report or molecular study report, all that, it has to be conveyed to the processing person in the insurance, who is not that knowledgeable. So naturally, it requires the treating doctor to fill up the column, the pre-authorization request form, and give all the details. This is the diagnosis, this is the line of treatment. And once this clarity is given to the insurance cannot take more time in raising unnecessary queries. So the treating doctor, be it an oncologist or a nephrologist or a surgeon, they have to take some time to complete the insurance documents and submit to the insurance companies. And insurance companies should understand different specialties and the benefits of new advancements in medicine and the growing specialties in the medical field. For example, pain medicine, rehabilitation, nursing care, home care, hospice centers, long-term acute care. There are a lot of newer daycare services that are available, which are expected to reduce the length of stay and give more comfort to their patient. So an insurance company should spend enough time to update themselves on medical advancements. So we say that, 30 years before, when we are in the medical school, we say hernia. Hernia means we think only of inguinal hernia. Today, hernia of the anterior abdominal wall is a separate specialty by name abdominal wall reconstructive surgery. And there are a lot of specialists and expertise and equipments involved. So the knowledge of this should be made available to the insurer. So between insurers and hospitals, there should be a lot of knowledge interaction happening. So every specialist, every modern advancements, they should give a brief to the insurance players. There should be a committee of major insurance players, and the insurance players should attend a briefing with these specialists. In the same way, clinicians should attend a briefing with the insurance companies. So once this understanding and this maturity happens, we can do a very good service to the patient. The clinician can spend less time on hazels and more time on a clinical service. So as I said, both of us are doing a business with the soul, both health insurance or hospitals. Both of us have to do our duty properly, and we have to work for a profit. It is not that we are in an industry where we have to work on the return on investment, but at the same time, we have to do it with the soul. We have to do it with some ethics, empathy to the end user, the policy holder in insurance company or the patient. So there should be adequate empathy, and we should be able to spend time and explain to them. And most important of all, every hospital should store the data. And try to say that if, every, in my experience, I've seen doctors saying, I'm a very famous man. I do hundreds of stents. I do hundreds of bariatric surgery or knee replacement surgery. Do you have a data? Are you monitoring the clinical outcome? What is the clinical governance? We don't have such things. So if you are using a mesh also in abdominal wall reconstructive surgery, there should be a QR code. And I should know that this is a mesh used for this patient, and I'm following up the patient, and this is a long-term follow-up, and this is my clinical outcome. And insurance, instead of paying just for activity, should pay for outcome. And very soon, hospitals may get a regulator where all these regulations, standardization of cost, standard operating procedures are coming, are it's going to happen in the next 10 years, because our medical education is very diversified. There are a lot of quality players, and at the same time, there are Namkewas hospitals, colleges. So, who is going to discriminate and tell the customers? The common man in India should know what is a good hospital, what is a ethical practitioner, and who is this, and who is going to tell this common man. Today, the most proximal opportunity to convey this to the common man on the hospital or doctor where they are taking treatment, how ethical they are, how standard they are, how outcome oriented they are. The most proximal people to convey this are insurance people. So that's the reason why insurance, health insurance, and the hospitals, they should not blame each other. They should work together in the interest of the patient. So if the patient is happy, and if there is a proper service given to the insurance policyholder or the patient, naturally it will enhance the prosperity for the hospitals, for the doctors, and for the insurance company. Every stakeholder in the ecosystem, be it a manufacturer of strength and processes, or a wellness condition management program company, or a healthcare technology platform, all the stakeholders are going to get the benefit in this transformation. Much depends on how sincere and straightforward they are going to participate. Because before, it used to be just, whatever the doctor says, the patient agrees. But today, it is not going to be the case. They are going to ask for evidence. So we are moving into evidence-based and value-based medicine in India. So at this context, I see a lot of opportunity for transformation in the healthcare space happening. And this transformation is going to benefit all the stakeholders. Only thing is, they should give importance to technology, data. They should be accountable, and they should understand that they should maintain a status on the clinical outcome of the patients they are treating. Okay. It is not just the activity for which they are going to be valued. It is based on the outcome, near-term to long-term outcome, which is very important. And this can happen only if they have a strong technology platform with them. That's my view.
Okay. Sir, your views upon technology and everything. So, but what about the smaller hospitals of India, like the smaller healthcare of India? How will that transform, and how will that happen?
Look, that's a nice question, because there is a feeling that smaller hospitals may vanish, and it is only the big corporates that are going to survive. And there is also a misconception that insurance companies favor big corporate hospitals. It is not like that. Insurance companies favors a hospital which is doing an ethical practice at an effective price. Are they practicing ethics? Are they charging the appropriate? This is what. Is there any fraud? Is there any abuse? Is there any misuse? This is what they are trying to look at. I know there are a lot of experts who are who have created a state-of-the-art center in gastroenterology, or in oncology, or in orthopedics, which are very small hospitals, but they do a very extremely good service. The size of the hospital is not a criteria here, because average length of stay for surgical procedures are decreasing. And 70% of elective surgeries are almost attempted to be done as a day care. So in this scenario, I should not say that just because I have a 100-bed hospital, I'm a bigger hospital. Your size can be small. It all depends on how you have built in your expertise, the infrastructure, and the support and safety precautions that you have for the patients. That is very important. A small hospital should continue to invest on technology. In a small hospital, the advantage is the owner of the hospital or the senior doctor, who is the specialist, he is going to monitor the patient. It is not like the registrars or the medical officers, the junior doctors who are handling, as in a big corporate hospital. The biggest advantage in a smaller hospital is individual doctors or specialists are going to monitor and offer services to the patient on a day-to-day plan. So in this context, I think that smaller hospitals should not get disappointed or apprehensive. They should gear up. They should build a lot of ethics. It is not the size, it is the quality of service that matters. And definitely they have a long future, provided they are equipping themselves with the technology and the basic requirement of an ethical practice.
Okay, sir. Sir, this is a very good interaction, and your views is very futuristic. That was, I'd say. So I guess
I really thank you for this opportunity, and
thank you, sir.
I look forward to meeting insurance alerts again and again, and this good information. We earnestly look forward for more and more people to understand and align, cooperate, and work together, because for the healthcare ecosystem to flourish, doctors, hospitals, and insurance companies should coexist. Let us coexist. I wish them all Godspeed. Good luck.
So thank you so much for taking out your precious time. I know how hectic it is for you. Thank you so much, sir, for the help, sir.
Thank
Thank
you. God bless you all. Bye bye.
Bye, sir.